Kathy, you have a program called the HoTS, H-O-T-S program.
Yes.
What's all that about? What does it stand for?
HoTS stands for Health on the Streets program. It's a program that started back in 2019. It's a mobile assertive outreach service across the entire New South Wales Central Coast, looking at providing medical and health assessments for people who are sleeping rough, who are vulnerable, or who are homeless on the streets.
Now this, from our friends at Coast Shelter, they tell us that homelessness is at an all-time high here on the Central Coast. I know across Australia as well. Has that been your experience too?
Absolutely. Back in 2019, the data that we had indicated there was over 8,500 people homeless on the Central Coast. And we're certainly seeing those numbers increasing.
The primary care organisation organises healthcare workers and GPs and so on, isn't that right?
Yeah, our team is made up of registered nurses, 2 outreach workers. One of our outreach workers has an Aboriginal background and he's also our team leader. And we have access to GPs across the Central Coast. We've also simultaneously run a program where we engage with GPs across the coast and connect them with our HoTS clients to access primary health care.
And you've got some good news for us.
Some fabulous news. We're thrilled today that we've been given some interim funding of $400,000, which enables our whole team and service to run for the next 12 months. We're extremely grateful for that funding, but we will also want to continue to push for the $2.2 million that was part of the election promise. I'm confident that we'll be able to work with Dr. Gordon Reid and Emma McBride to achieve those aims, which will enable us to obviously build and grow the current service further across the coast. Now,
we've talked to both of them and they said they didn't themselves promise funding. However, the now opposition did promise that funding, but you're hoping to put a case to make this a permanent post, I take it.
Yeah, we were very fortunate in the previous member for Robertson helped support the initial funding. The idea of the Health on the Streets program actually came from one of our staff members who was passionate and kind, but could also see the gaps in our services, and along with that idea and the funding, the HoTS service was started. But yeah, we would like more funding. There's a lot of opportunity there where we could potentially expand that service across 7 days a week, and particularly also help people in those evening and after hours times where often that's where the need is greatest, and it's the time when a lot of services have closed for the day. So there's certainly lots of opportunity and areas that we could provide a larger service to.
Now we understand through our journalistic pursuits that getting medical papers for people who are homeless is one of the greatest challenges when seeking, for example, social housing or other services. Do you help with that?
Building trust with our clients is really, really important, and that certainly can take time. We have to obviously have consent from the client in order to access information.
So it's important to get them into the system, I take it. That's your...
Yeah. Absolutely. Really important to get them in the system, and it's not a quick process. 15% of our client group have come from a domestic violence situation, but 93% of our clients present with a mental health issue. And that in itself can be a barrier to accessing services or information that the client might need to then go and access another service.
Now, this must be a concern and a situation over the whole country. Are there any other regions that you're aware of around the country that offer something similar?
As far as we're aware, this is a unique service in the country. I think the ability for our service to not only address the medical and health issues, but also to the social support, mental health, as I mentioned, access to NDIS, the scope is much broader than other services that we're aware of. The service is nurse-led, and that does enable us to have really good access to a number of different nursing practitioners who might have a drug and alcohol expertise, sexual health expertise.
Well, congratulations on first your lobbying efforts. I know that's short term, but good luck with the ongoing. We'll follow this story.
Thank you.
Is there anything else that you'd want to say in closing?
Health on the streets, if the service wasn't there, the vulnerable would be more vulnerable. Where the ability to return some dignity to some of our clients who for some are in bad situations through no fault of their own, we wouldn't be able to achieve those outcomes if the service wasn't there. So we are very grateful for this interim funding. It's a fantastic outcome, but we're also very keen to do more in the future, particularly for the vulnerable on the Central Coast.
All right. Well, thanks for coming in to speak with Central Coast Newspapers.
Thank you for having me.